And that's when it really started my journey digging deeper. I felt like with some conventional or allopathic approaches to health or wellness, that I felt very stuck and that I wasn't finding answers to what was going on in my body.
Welcome to the Holistic Counseling Podcast, Amanda.
Thank you. I'm excited to be here.
So tell me more about your journey and what got you where you are today.
So it actually starts with my health journey. So I've actually struggled with hypothyroidism for about 12 years now, but it really wasn't until I'd say 2013 to 2014, after I had graduated graduate school, that I started to notice more issues around my energy levels, my mood, fertility, as we were starting to plan for a family. To at that point in time, about a year later, was diagnosed with Hashimoto's, other hormonal imbalances. And that's when it really started my journey digging deeper. I felt like with some conventional or allopathic approaches to health or wellness, that I felt very stuck and that I wasn't finding answers to what was going on in my body. At that point in time, and I think other people can kind of empathize, you sometimes wonder how much of it is psychological or just that you're creating all of these symptoms because you're not getting these answers from doctors to really improve your health. And so
It's got to be
this
frustrating too.
very frustrating. And I think with even our own clients, maybe whether it's complex trauma or their health struggles that tend to correlate with each other, chronic health conditions, that they often feel very stuck or start to question, maybe it is in my head and I'm just kind of manifesting some of these symptoms. This is where I started to go more deep dive into functional medicine, which really does focus on root causes to a lot of health issues. And this really was the driver of rebranding my practice, the Holistic Counseling Center, to really start to encompass that mind, body, spirit, because even in my treatment with clients, I felt like I was hitting a wall with talk therapy too. And so it kind of came together with really is knowing with my own experiences and literature and clinical practice that there's more to mental health or health overall that is driving, people's struggles with mood instability, depression, anxiety, and just the interconnected aspects of the mind and body.
How did it help you to use functional medicine?
That is a very good question. So it really caused me to look at my own lifestyle and really look at my own history with complex trauma and how the stress response, the nervous system dysregulation impacts the body, as well as, nutrition, movement, sleep, the quality of nutrients in my food, etc., was impacting my health and mental health at the time.
So you said functional medicine looks at more of the root cause.
Yeah. Mm-hmm. So when we talk,
how do
yeah,
you integrate that with mental health practice
that's a
with
very good
clients?
question. Yeah, so I have over time taken more trainings with nutritional psychiatry or integrative medicine and mental health. So, obviously we have limitations in the way we can practice this, but a lot of it's psychoeducational or encouraging clients to, create some of these habits at their own pace. And I do work a lot with practitioners outside of my practice, like functional medicine doctors or functional dietitians, to collaborate because they can do more extensive lab work than obviously I can. And, whether we're looking at nutrient deficiencies or we're looking at imbalances in someone's hormones or their gut health, or even heavy metals or toxins and how that inflammation in the body impacts brain health. And so they're able to dive deeper into that and recommend individualized supplements or protocols to help them.
So you're almost like a bridge between that too, isn't it?
Yeah, to some degree. Mm-hmm.
Yeah. Okay. Because I know we can't prescribe like supplements or those kind of things. That's what I wondered, like, how does this work? This is very interesting to think about how
Yeah,
you can collaborate with them.
yeah, so even nutritionally, I can make kind of generalizations, with, what would help based on literature, balance plates and those sorts of things, or educating clients and how, adding certain foods can improve their cognitive function or mood stability, etc. We also offer walk and talk therapy as an option to get in more movement and how movement can be very helpful, as well as we offer yoga therapy too. But yeah, when we get down to the nitty gritty, we're really looking at the individual at the root more in depth. That would have to go to a medical practitioner that specializes more in that area.
Yeah, I could see that. No. So in your experience, have you discovered like causes of anxiety? Is there more functional medicine things that you've noticed or?
Yeah, I mean, mhm.
I know you mentioned trauma and the sympathetic nervous
Yeah,
system
so,
too.
and I think your work too, the dysregulated
Yeah.
nervous system and looking at how complex trauma impacts our stress response and anxiety. So that's a piece. And then gut imbalances. So, some of my clients, or just based on the research, SIBO can be a big factor, which is small intestinal bacterial overgrowth, gut dysbiosis, where you have higher amount of bad bacteria in the gut versus good bacteria. A big one that a lot of Americans actually struggle with is intestinal permeability or leaky gut, where the immune system and other toxins get into your bloodstream and start to create more inflammation, which is correlated with autoimmune conditions. Nutrient deficiencies, so like being low in vitamin D, which a majority of people know about with depression, anxiety. B's, vitamin B's are very important when we talk about creating neurotransmitters, mood and energy. So that's usually a big one that I encourage clients to look into. Low iron, blood sugar is a big one too. So if we're eating infrequently or we're not eating enough, that we can have dips in blood sugar, which increases cortisol as well. Other hormonal issues, such as like thyroid, can be a big one. Hypothyroidism or even hyperthyroid would be more like restlessness or keyed up, versus hypo, you might have more mood instability, depression, lethargic. I'd probably say those are kind of the big ones.
And it sounds like a crossover to a lot of potential causes of depression too.
Yeah, I mean, there's a lot of overlap. And this is what kind of just intrigues me. And I think it's just sometimes we play whack-a-mole with all these
It
different
is.
things.
Don't you feel like a
Because
detective?
yes. Yeah, or encouraging clients to go get some of these tested
Yes.
because, I mean, I think we're becoming more well versed in these areas, but just kind of doing a rule out because
Sure.
we could be providing these skills that are very helpful, right? Or doing, more in-depth trauma work. And, someone could have undiagnosed thyroid disorder, which isn't actually quite uncommon with those,
Exactly.
right, with struggling with trauma. Oh, yeah, I was thinking of like estrogen or sex hormone issues too, can be a big one.
Yeah.
Because I am seeing a huge uptick in like young women or teens having irregular menstrual cycles. I think there's a number of factors, whether it's stress or quality of nutrients from our food, that are impacting these things as well.
Yeah, and I think that you bring up a good point is the age of the client because I have some that are menopause age and that can be a big change of life and a lot of changes
Mhm.
with hormones that can cause depression and other things like irritability. And so we have to look at all these factors. We can't just overlook that.
Yeah, so that one's not uncommon. Obviously, estrogen, progesterone, or testosterone really starts to tank right around 35 and after for a lot of women before they even get to menopause.
Oh, is it
Um,
35? Wow, I didn't know
yeah,
that. Mm.
because I actually just revisiting to get my stuff like looked at again. And the doctor that did it, she was like, yeah, about 35, we're starting to look at testosterone and all these hormones as or your body
Wow.
starts to prepare years in advance. I was like, oh, okay.
Limited
So
time.
I know exactly.
So the clients that you see, do you have them all like do different kinds of tests, or is it just certain clients?
I mean, I think it just depends. Like you said, I play in, and being investigative. And yeah, I think it just depends. I usually do like a little medical history, like family
Okay.
history, if there's anything on the radar. I do ask about what nutrition looks like or daily movement and those sorts of things to get an idea. But generally, if my clients are presenting with depression, anxiety, and they haven't, because it's not common practice, especially my teenagers, to look at these sorts of issues, even if they are like reporting chronic fatigue or depression, anxiety, or mood instability, or irregular menstrual cycles, it's passed as it's normal, even though, like, it might be common, I should say, but it's not normal for those things to be occurring for young women or teens. And so this is where I encourage them to follow up with a medical provider to look into any nutrient deficiencies or other hormones, specifically like a thyroid issue, to do more. And even then, it's kind of limited with like a pediatrician or a primary doctor for them to look
Yeah.
way more in depth. And that's not necessarily the provider as much as sometimes it's managed care.
Yeah, because
Mm-hmm.
I know I talk to my young adults a lot about getting a physical because they look at me like, "What? I'm healthy."
Uh-huh.
Everybody needs a physical. But is there certain tests, like, I know you said that, like, vitamin D might be one that
Yeah,
they had do
especially
they
here.
have to request that? Because that isn't a regular test that they do, right, for
No,
blood work?
generally they'll do kind of a metabolic panel,
Mhm.
looking at your lipids and blood count and those sorts of things. It's not general practice for you to go in and get like a thyroid panel. I think maybe more doctors are better at it here in Michigan, but like a vitamin D panel as well. Iron or ferritin. So ferritin's your iron stores over the last few months. And then I encourage like a fasting glucose as well. Or hemoglobin A1C also gives you an idea of what your blood sugar levels are looking like. Insulin, but that one sometimes is hard to cover. But that would also give us an indication with like diabetes or insulin resistance that impact mood. Mm-hmm.
I've seen that. I can't tell you how many times over the years with people who have gotten blood work and they're like, "Oh, I have a thyroid issue, and that could be causing depression." Or, "Oh, yes, I don't have enough vitamin D, so now" then their mood gets more elevated. It's like no amount of counseling can undo undo that if they don't get the help
No.
right medically.
Yeah, no, unfortunately. But too, if it's deficient, it's like night and day, like you said.
It
Mm-hmm.
is.
Yeah.
Yeah, this is why it's so important, I think, to look holistically, to really look
Mm-hmm.
at all the different factors. And I love how you start with the intake form too. And
Yeah, and then too, sometimes they forget on an intake form, but like in conversation when you're getting to know your client, sometimes those things can kind of come up. So generally I encourage someone to get a full thyroid panel, which isn't just the TSH, which is the thyroid stimulating hormone. That is actually produced by your pituitary gland to tell either your thyroid it needs to pick up production or slow it down. This can be really impacted too with stress because this is responsible for metabolism and regulating your mood and energy and body temp and all of that. So if we're under a lot of chronic stress, which isn't uncommon, right, with our clients that struggle with complex trauma or dysregulated nervous system, that definitely can be a big factor. But back to the thyroid panel, TSH, and then free T4, free T3, and antibodies are a full panel. Some
okay.
would even say reverse T3. But the reason it's so important to even look at free T3, which practitioners might push back a little bit on, is because it is responsible for your mood and energy. That's like the powerhouse of everything. So your body actually has to convert T4 to T3 for us to use it in our body.
Mm. And that's so important with depression too. I see so many clients that come to me too with fatigue and they have no energy and it's so
Mm-hmm.
hard to, we can try all these different things with yoga, meditation, all those holistic things, but if there's something medical, there's only so much we can do. So that's good to know that that could be something to investigate.
Yeah, and like I mentioned before, the iron, the glucose, all of those sorts
That's
of
true too.
things.
Mhm.
Yeah, I mean, if you go to a functional medicine doctor, they'll actually go way more in depth about like what is outside your cell and what your body is intracell or, within the cells, like what your body is utilizing for vitamins and minerals, versus an allopathic or conventional model, like if you were, like I said, go to your family doctor or a pediatrician, they're going to be a little more limited in their capabilities of diving deeper into what's
Yeah.
going on. Yeah.
I have a weird question, but I've had this come up several times with clients. A lot of clients that eat a lot of junk food and soda. So,
Hmm.
and of course, they have some, different mental health concerns. So, how do you address that with clients? I'm always like,
Yeah.
hmm, how do I approach this without
I
defensiveness?
know. No, you're right. Because people
Because
definitely,
I
when
ask
we talk
that,
about,
yeah, I'm very clear
yeah.
on my assessment forms, but then I'm always kind of like, well, how much water are you drinking?
Yeah. Well,
you
because I
know?
think too, when we talk about nutrition, there's like this personalized piece that people could perceive like an attack. But you're right, when we look at the standard American diet, it
Yeah.
is like ultra processed foods and sugars. They taste really good. What I focus on with clients is, well, one, if they don't even want to make those changes, okay, then we're going to radically
And there we are.
accept. There we
Okay.
are. If there is willingness and
Sure.
interest
Mm,
around like understanding how
okay.
nutrition
Mm,
impacts body, how I really approach it is adding.
adding.
Psychologically,
Mhm.
when we add foods, like for example, protein is a big macronutrient that a lot of people undereat, and especially women, but it's so important for building in the body. And so they are open to it. Rather than taking away the sugar and the pop or soda pop or whatever we want to call it in different states.
Whatever part
Yeah.
of the United States you're in or country, right?
Yeah. That when we have resistance, then people are less likely to want or like, follow through with it versus
Yes.
if I'm
Mhm.
adding, there's more
Mhm.
empowerment,
That's true.
there's more control, or I don't want that is another way I reframe things because of how it makes me feel. If we can tie in the importance and the meaning too is very
Mhm.
important with change. But yeah,
Mhm.
baby steps.
Yes.
Um, and then adding. So
Okay.
adding
Mm,
or alternatives are really helpful too.
that's true too. Yeah.
Hmm. So
So
like
do you
yeah, go
yeah.
ahead.
I
So
was just
sorry.
gonna say, do you ask clients too about like what are they eating? Because sometimes I get a lot of information just asking like, tell me about a day for you, because just so
Okay.
I know, because I have a lot of people that fast all day and they just don't eat. Period.
Yep, that's a thing too.
That's
Intermittent
a thing.
fasting. Yeah, it's a thing.
Yes. Yeah.
But
Mm.
yeah, so I do ask. So in my regular daily assessment with clients, because I do work with clients too that are sometimes chronically suicidal or engage in self injury. So naturally, I'll ask about safety. And then I'll lead into like, what does your sleep look like? What did you have today to eat? Because I do have some clients that struggle with disordered eating where there are patterns of restriction or binging and purging. So I do ask about like quality time of day when they're eating. So, too, if they're reporting anxiety or depression, I want to know like, are there gaps in the eating that might be causing blood sugar to go down and cortisol to
That's
go
true.
up? Because
Mhm.
sometimes people can have panic attacks or excessive amounts of anxiety when that happens.
Oh,
And then obviously exercise too, and hydration, all the
yeah,
things.
so important. Yeah.
Yeah.
No, there is so many factors, and I think that that's why it's important to be holistic.
Mhm. I know.
I don't know
Yeah.
how you can't be.
I know. Yeah. And well, even then, just I think all the years of doing like CBT,
Yeah,
DBT
for sure.
work, you start to like, there are clients that aren't necessarily responding to those
Sure.
modalities. And then, you think about more research around trauma and the body and using somatic approaches too to that. So I don't know. I'm
That's the
with
best
you.
result, yeah, I
Hmm.
think, to
Yeah.
integrate all that, and so what
Yeah.
kind of clients do you see then who
So
benefits best from your practice?
a majority of people that we see are adolescents and adults. So we kind of, go up to people that are in their 50s, 60s. It's kind of what we attract. But most of it is teens and young adults. We are trauma-informed practice, so a lot of individuals are coming in specifically seeking like EMDR treatment or somatic practices to healing the body. There are a few people that are attracted to the nutritional side of things or more integrative too. But most of these teens and adults are struggling with depression and anxiety, complex trauma, PTSD, sometimes personality traits. So I do work a lot with borderline personality disorder. So yeah, those are primarily the diagnoses that we see here. Oh, is that anxiety, right?
Yeah, of course.
Yeah. Yeah, no, as we go down the laundry list here.
That's funny. So what are some misperceptions of functional medicine? I guess, do you get pushback from people?
I think even probably just the holistic aspect of things too, overall, is kind
Sure.
of woo-woo, right? I'm sure you've
We
heard
embrace the
that.
woo on the holistic counseling podcast.
I know, exactly. Because people are skeptical. But
Yeah,
I
yeah,
really think,
exactly. Hmm.
when we talk about functional medicine, it's like, even in the medical field, they're very behind what the research, versus clinical practice. They're a number of years behind where we are with, what can be very helpful for people. So, with that said, yeah, I think most of the time people are skeptical when I talk about root causes of things. But I think once somebody is struggling with a lot of health issues, which isn't uncommon when we have people struggling with PTSD or complex PTSD, that they start to question the system, because what happens is they're trying to communicate. And I think we even run in this when we're treating trauma, and they feel very helpless or powerless because they're not feeling heard and seen. And so that's where generally a lot of my clients start to kind of be more open-minded to the functional piece. But other people, I think, kind of question the model because of the science piece. But there's a ton of research backing efficacy of
Sure.
functional
Hmm.
medicine. And I think the shift that we're seeing even in America for people wanting a different modality of treatment, whether it's in our field or even in the medical field, to get more answers and to actually have health and wellness. And I'm going to say it, not sick care.
Yes, thank you.
Yeah, drop that mic on that one. Yeah, this, because I think the way that the system is currently set up and the frustration is they're bound by, here's symptomology. What we know what to do is medication and procedure. And if we don't fit in those categories, right, if I can't write you a script or I can't send you off to get this procedure done, then you're okay, you're fine,
Oh my
but you
gosh,
don't
I know.
feel fine.
It makes me crazy. Yeah, I have a
Mhm,
lot of back problems, and traditional medicine has failed me with chronic pain. And, I had some hip bursitis recently, and I had to do my own investigation. We have to be our own advocate for care,
mhm,
right? Found some exercises from this physiotherapist, they call that physical therapist in UK,
uh-huh.
and, was doing these exercises, and it's about gone. But I mean, I went to the regular doctor and they're like, well, maybe we'll give you a shot. They're just like, I don't know. There's not much we can do. Why didn't you just tell me how to do this? Because I've had this like 4 other times. Like, it's like so frustrating when there's things that are out there, right? To look at the
Mhm.
whole body and different ways to manage different things. Yeah, that's just
Yeah, that is
personal
really
experience.
frustrating.
It
Yeah, and I
is. I
ran
mean,
into that too. Mhm,
absolutely. And this was a total, like, I've gone to different physical therapists, but this one had different exercises that made a lot of
mhm,
sense that really didn't aggravate it. Because sometimes physical therapy can aggravate things,
mhm.
not in a good way, you know?
Yeah, and I think people that are attracted to the
Yeah.
practice itself, run into this, and they're seeking more
Yes.
help. Because you get to a point of having to be that person that, and I'm a firm believer in educating yourself, just because I think knowledge
Oh,
can
for
provide a
sure.
lot of empowerment for our clients.
Exactly.
And so by the time they get here, they're like, I'm looking for EMDR and I'm looking for this piece.
Exactly.
Yeah.
'Cause I was thinking,
Help.
yeah, with more of the traditional medicine, I wish they could provide even just, "Can we just have some Reiki thrown in there?" Like, why do I have to go
Yeah.
someplace separate and
And there
yeah.
are some practitioners that are keeping up and trying to
Oh, for
integrate some of
sure.
these things. And,
I mean,
you
can you
know,
imagine? That would be
yeah.
such an amazing healing to have all these
Hmm.
other integrative practices, and
I'm with you. I know.
I know they're
And there's
starting to, but
they are starting to. We're doing more like panels around hormones or gut health. I've had,
yep, for sure.
some practitioners look into that a bit more. And, not to like dog on allopathic or conventional, right? That there are times and places, if there is an emergency or an acute issue of some sort, they're wonderful to go to. It's
Of
just they're
course,
not
yeah.
doing a very good job in regards to chronic mental health or chronic
Yes.
health conditions. And so this
Agreed.
is where we need to look at the whole body to, yeah, because everything's
For sure.
interconnected. Yeah.
Do you have
Mhm.
any success stories from clients that might have been hard to treat and that you were able to or themes that have come up?
Themes, yeah, I mean, I've worked with a lot of clients for a number of years,
Yeah.
kind of on and off, and I think it's just been like steps. And so, I do work a lot with clients, a lot of complex struggles. And I think it's just kind of like, can we bring down the safety piece, right? And once we have skills around managing emotions and building, the, I guess I'll say, tolerance or the resiliency piece, then we can maybe have more comfortability around adding lifestyle or getting to a point of doing more in-depth trauma work, whether it's EMDR, somatic experiencing, etc. But I do have clients that have a lot more stability and quality of life, or I guess being able to have more boundaries and empowerment with finding these answers and realizing like I had health issues and I didn't know
Exactly.
until I went and got more
Yeah. Mm.
testing. And that was where, interesting enough, starting with a therapist, recommending getting those things done. So, yes, but keeping in mind, like, whether I'm working with somebody struggling with BPD or complex PTSD, like that takes a long time, as you know, with
Yeah, of
healing.
course.
And so with them, it's more step by step, I guess playing crisis management and then lifestyle kind of at the ladder and
Mm.
prioritizing. But I have had some success stories in that regard and people feeling better with being able to add supplements or starting to make
Okay.
dietary
Mhm.
changes or I guess EMDR treatment and these other modalities too, all
Mhm.
encompassing. Yeah. But it takes
Yeah.
time.
Yeah, and I think it is a multi-pronged approach, I think that really helps with healing. I don't know if you've noticed that too. It's usually not just, "Let's just do EMDR or brain spotting. Let's just do,
Hmm.
CBT." To me, it takes a lot of different modalities, the combination of
Yeah.
things, and finding the it's like finding that right key for the person.
Yeah, and I think too, like, when they get to their place in this healing journey, like, are they willing or more receptive to that other transformative piece at that, you know what I
Mhm.
mean? Like, so some of my clients who I've gone through EMDR with, or they've started to make these lifestyle changes, I'll recommend more spiritual aspects, such as our Reiki healing or
Sure.
more of the breath, adding more breath work, or the trauma informed yoga
Yeah.
piece. Yeah. So you're right. It kind of just depends on where they're at, how they need to receive
So
the,
it sounds like you kinda have, like, different tiers then. You have to crisis first, you said, and
yeah, mentally in my mind, right?
No,
Yeah.
I think that's helpful.
Yeah.
Yeah.
Because, if someone's in crisis, they're not gonna, I mean, not that they couldn't benefit from some of these things, but they might not be in a space to really hear it. So I think it just kind of
Okay,
depends
yeah.
where they're at
You said
too.
they to be in the space of hearing and receiving it, so that's
Mm.
really helpful, I think, for listeners who are a lot of mental health therapists out there, and
Mhm.
a lot more excited to use holistic things, but just keeping that in mind, is this client in a space to receive it?
Mhm. Yeah, that is very
Some
true.
That's something
Mhm.
to think about.
But yeah, I mean, even then, I take it back to the basics of like safety and attunement and that attachment piece that's so vital in the role that we play with their healing.
You got me
Hmm.
thinking, Amanda.
Yeah.
It's like,
Yeah.
but I
I
wonder
know.
too if clients you feel stuck, right? That you feel like you're not helping them. That if that be that that it's not the right time for them for certain things, or
Or maybe even that
yeah,
transference piece, right? Like
that's
they feel
true.
stuck too. Yeah,
Hmm.
and then you're picking up on that energy as well in session. Yeah, I mean, don't get me wrong, there's times of stuckness, and this is where consultation's very helpful.
Sure. Yeah.
Or having a
Exactly.
conversation with the client and what they're experiencing at that point in time too.
Yeah. Just
Yeah.
that open transparency, I think, can make a difference with a client too, and
Mhm.
talking about what's in the room,
Yes, I'm with you.
which is hard
Mhm.
sometimes.
Very true.
I'm a clinical supervisor, so I get my supervisees kind of look like deer in headlights when I say that to really bring stuff like that up. They're like, "Oh my god, I'm supposed to like bring that up to the client."
But it's so helpful because a
It
lot of,
is. It
I mean, they're
is.
so, and you experience this, they're so disconnected from their bodies,
Sure.
that there's not an attunement of like what
Yes.
physical sensations and what am I noticing. And so when you start to point some of that out, yeah, there's some uncomfortability, of course, but it can be very helpful
Mhm.
therapeutically. Yeah.
Oh, yeah, and that can help you push through too if you are feeling stuck and if you
Hmm.
both are,
Yeah.
to see where you wanna go with therapy and
Or even, I'm not an expert in this particular area, but like, the stuckness, is there like a protective part that's coming up when we talk about
yes.
parts work? Yeah.
Yeah,
And
sure.
being able to explore that with clients and seeing that more as a strength and being more curious or investigative of how that's been helpful to them. So sometimes I'll use that. The model I got trained in with EMDR was a safe model. So we do incorporate more somatic and attachment, and
Mhm.
so we really do try to create more like curiosity around resistance or blocking or
Sure, yeah.
stuckness and not really framing it as that. Yeah. And how has this been helpful to the client?
Or is there a
And
part that's resistant?
yeah, there you go. Right.
Yeah, I
Yeah.
just had that with a client this week. It was just so interesting. I've seen this person for a long time. We are talking about how long I've worked with her, and it was like I didn't realize that she was really stuck in the adolescent part of herself. It
Hmm.
was like a resistant part that would like not wanna I don't wanna do that self-care. I don't wanna do that exercise, and so we really worked through it this week, and I was like, it took me long enough to really recognize it, but a little slow.
Yeah, and the more work we do around like
It is.
child self, right, or adolescent self that's coming up, or an adult protective self,
Yeah.
the more clients like will be able to identify and use most,
Yes.
those parts. And I love parts work because the compassion piece or reducing shame
Oh, for
around,
sure.
yeah,
Mhm.
so that's been really interesting
Yeah.
work
So
too.
what would you recommend for therapists who might wanna learn more about using functional medicine or nutrition with clients?
Very good question. I would say educate yourself and understanding some of the presenting symptoms that clients are coming in with, that with our lens, right, or biases in our training, we might not necessarily be looking into these other factors that might be contributing to our clients' well-being. So not only educating yourself on some of the presenting symptoms with our clients, but maybe if you're interested in more training, that is always helpful too, or consultation or collaborating with other practitioners in the area, like have more training in that area, or
Mhm.
for, medical providers that could be helpful too, because it's nice to work together as a team. Yeah.
Yeah, and I had been going to, before the pandemic, a functional medicine. It was a consultation group, but it was functional doctors at this office, but there were therapists. It was like a whole integrative thing. But and of course with the pandemic happened and a lot of things changed. But if you have something like that in your area,
Hmm.
and just ask because you never know what can be out there as
Yeah,
far as
true.
that goes. For
Hmm.
consultation. So, do you have a takeaway, something you could share to any therapists who might just be starting their holistic journey and maybe they're hesitant about integrating anything holistic?
That's a very good question. I feel like it always often comes down with like educating and consulting. I think even understanding boundaries within our own scope too, because there's a lot of overlap in these areas, and just getting the added support from these other practitioners or providers that could be helpful to you if you were interested in diving more in depth in these areas. For me, it was kind of my own journey and wanting more answers, and then just kind of obsessively educating
I hear you.
myself. Yeah. And I'm always learning, and I don't have all the answers, and that is okay.
And that's okay. Yeah, no, I
That
think
is
that's a really
okay.
good start. I appreciate that with
Mhm.
getting more information from other providers, I think can be a good start. So what's the best way for listeners to find you and learn more about you?
Yeah, you can reach out to us through our email info at the Holistic Counseling Center gr.com, as well as our social media account on Instagram, the Holistic Counseling Center gr. The gr is very important.
Yes. I just love the name of your practice. Of
I
course
know.
I do.
Yeah, a lot of
Integrates well with a
similarities,
podcast.
right? Yeah, it does.
Love that. Well, thank you so much for coming on the
Oh,
podcast,
thank
Amanda.
you. Hopefully today was helpful. I
Yeah,
appreciate
this
it.
was
Thank you.
really fun. And thank you, listeners, for being here along this journey. Do you always put others' needs before your own? As counselors, we often prioritize the needs of others. But I have a book for you that is an invitation to turn that nurturing energy inward. Discover practical self care rituals, ways to upgrade your daily transitions, and small gifts you can give yourself designed to replenish your energy and cultivate resilience. It's not just a book, it's a companion for those moments when you need a little gentle reminder to prioritize your own well being. So treat yourself the gift of self care. Go to hcpodcast.org/self care. That's hcpodcast.org/self care. And once again, this is Chris McDonald sending each one of you much light and love. Till next time, take care. Thanks for listening. The information in this podcast is for general educational purposes only, and it is given with the understanding that neither the host, the publisher, or the guests are giving legal, financial, counseling, or any other kind of professional advice. If you need a professional, please find the right one for you. The Holistic Counseling Podcast is proudly part of the Psych Craft Network.